In the realm of environmental disasters, the Flint Water Crisis stands as a grim reminder of how a systemic failure can lead to unimaginable consequences. Located in Genesee County, Michigan, the city of Flint faced a catastrophic situation where its residents were exposed to highly elevated levels of lead in their water supply. This crisis, which spanned from April 2014 to October 2015, had profound implications for the health and well-being of the community. The dire ramifications of the Flint water crisis shed light on the intersections of governance, infrastructure, and public health. The origins of the Flint water crisis can be traced back to a decision made in 2014 to switch the city's water source from Lake Huron treated water to the Flint River. It was seen as a cost-saving measure during a time when Flint was under emergency management imposed by the state. However, this switch had unintended consequences. The corrosive nature of the Flint River water, untreated for its lead content, caused the aging pipes of the city's water infrastructure to erode, releasing lead particles into the water supply. The lack of proper treatment and oversight became a toxic cocktail, poisoning a city and its people. The immediate impact of the lead-contaminated water was devastating. Lead is a potent neurotoxin, particularly harmful to children and pregnant women. Residents of Flint unknowingly consumed this toxic water, leading to numerous health complications. Children began exhibiting symptoms of lead poisoning, including developmental issues, learning disabilities, and behavioral problems. The effects were not limited to physical health. Psychological distress and a loss of trust in the government also took a toll on the community. As the crisis unfolded, it became increasingly clear that the situation in Flint was not receiving the attention and urgency it demanded. The plight of the city's residents, who were predominantly low-income and African American, exposed the deep disparities in environmental justice. The slow response from both local and state authorities exacerbated the crisis, prolonging the suffering of the affected population. It wasn't until independent research and activism by residents brought national awareness to the issue that action was taken. The Flint water crisis sparked a wave of investigations, legal actions, and policy changes. The failure to provide clean and safe drinking water to the residents of Flint not only had immediate health impacts, but also led to a loss of faith in government institutions. The aftermath of the crisis saw criminal charges against public officials, lawsuits demanding compensation for damages, and efforts to improve water infrastructure across the country. The lessons learned from the Flint water crisis extend far beyond the borders of Michigan. It served as a wake-up call, highlighting the urgent need for comprehensive reforms in water management, environmental policies, and accountability. Efforts to prevent similar disasters have included stricter regulations, increased transparency, and improved communication between government agencies and communities. However, the scars of this tragic event remain, reminding us of the immense impact that a failure in our infrastructure and governance can have on the lives of ordinary citizens.